Occasional anxiety is an expected part of life. A quote by Dan Millman says it perfectly. You don't have to control your thoughts, you just have to stop letting them control you. Today, I am here to inform this audience of COM 110 students about general anxiety disorder. I will discuss the symptoms, diagnosis, and treatments. Now on to my main points. My first main point is to give you symptoms of general anxiety disorder and tips on how to reduce anxiety in a natural way. Mayo Clinic states that some of the common symptoms of anxiety include the following: feeling nervous, restless, or tense, having a sense of impending danger, panic or doom, having an increased heart rate, breathing rapidly, trembling, having difficulty controlling worry, and having the urge to avoid things that trigger anxiety. Dana Smarts at Mayo Clinic, January 13th of 2018, lists some ways to reduce your anxiety. Keeping physically active. Dana states that exercise is a powerful stress reducer and that it may improve your mood. Discussing your concerns with a trusted friend or family member may provide a more positive perspective on your situation. Dana also states that using stress management and learning to relax can ease anxiety. I have just discussed my first main point, the symptoms of anxiety and how to naturally reduce them. My second main point is how to get diagnosed with anxiety from a mental health professional. According to Very Well Mind by Deborah R. Glassifer, PhD, February 15th of 2021, she is listing off of the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders. Its guidelines about how mental health professionals look for factors like the presence of excessive anxiety and worry and having it for at least 6 months or more. It must be unrelated to any other medical conditions and cannot be explained by a different mental disorder. Deborah Glassifer, PhD, states that anxiety and worry are accompanied by at least 3 of the following physical or cognitive symptoms: edginess or restlessness, tiring easy, which is more fatigued than normal, impaired concentration or feeling as though your mind goes blank, irritability, which may or may not be observable by others, increased muscle aches or soreness, and difficulty sleeping due to trouble falling asleep or staying asleep, restless at night, or unsatisfying sleep. I have just discussed my second point on how to get diagnosed from a mental health professional for anxiety. My third main point is the treatment of general anxiety disorder symptoms. There are many ways to treat anxiety, but today we will be talking about on how to treat them by seeing a mental health professional. Referring to Mayo Clinic, there are 2 main treatments for anxiety disorders, which are psychotherapy and medications. It may take some trial and error to get what works best. Psychotherapy, also known as talk therapy or psychological counseling, involves working with a therapist to reduce your anxiety symptoms. The most effective form of psychotherapy is CBT, cognitive behavioral therapy. It focuses on teaching you specific skills to improve your symptoms and to gradually return to the activities you've avoided due to anxiety. There are several types of medications used to help relieve symptoms of anxiety, like certain antidepressants and anti-anxiety medications. For example, one is buspirone. You and your doctor will figure out what works best for you. I have just discussed my third main point, the treatment of anxiety symptoms. I have just discussed 3 main points, the Symptoms, the diagnosis, and treatments for general anxiety disorder. Anxiety disorders are highly treatable, but only about 36.9% get treated. General anxiety disorders affects 6.8 million adults, or 3.1% of the U.S. population. Yet only 43.2% are receiving treatment, according to the Anxiety and Depression Association of America on February 17, 2021. A quote by Charles Spurgeon sums it up. Anxiety does not empty tomorrow of its sorrows, but only empties today of its strengths.